is what can I eat when? And of course, as you know, what we recommend in the book is for the first, what we call stage 1, which is somewhere between 10 days, 2 weeks, or even up to a month, you're kind of limited to yogurt, Gatorade, soups, crackers, juices, water, things like that. And that doesn't take long until that gets pretty old. Now, some patients note in the manual where it says you may get increased weight loss if you can stay on stage 1 for a full month. We only put that in there as kind of a little trick. Some of our patients are what we call obsessive compulsive, and those people need something to do, otherwise they'll call you about stuff. And so we leave that in there for them. But to be honest, the weight loss is related to your surgery and not how long you're on stage 1. Now, you can then start to eat other things soon after the surgery. But those, quote, other things need to follow our guidelines. And so I'm going to say this probably 3 or 4 times just over and over again, because although you hear them, if you're like our other patients, you're going to forget them and violate those rules and cause trouble. So let me just say them to start off with. Anything after surgery is almost anything is okay. Almost anything is okay if you take it in very small amounts, very slowly, and very well chewed. Okay? So I had a patient of mine who was a contractor, and he came back a week after surgery to say hi to everybody. He said, look, I'm a contractor. I left the hospital. I felt great. On the morning after surgery, when I left the hospital, I stopped by a job. I estimated the job. And then I went by Mcdonald's and had a hamburger. And so I'm thinking to myself, I got to stop letting these people talk, I got to screen them first, And he said he peeled it off. He didn't have all the bread. He had just one bite, and it gave him the taste that he wanted, and that was it. And so actually, that kind of thing is possible. Now, another thing that we get is people ask about broth versus soup. In other words, in the post-operative period, does it have to be clear broth, or can it actually be soup with noodles and things like that? And I say, very small amounts, very well chewed, very slowly, anything's okay. And then Trish and the girls get very angry because they get patients who go out, they get their chicken noodle soup, they pour off the broth, and then they take a big spoonful of a solid brick of noodles. And then they call upset, they're having pain and nausea and things like that, and they say, Dr. Rutledge said I could eat it, it was okay. So we're not saying, when we say soup, that you can pour off the broth and have a solid block of pasta. But we are saying, like chicken and stars and chicken and rice and things like that, all those things are fine. Small amounts, think baby spoons, very well chewed and very slowly.
What if you blended or puree or something?
That's another question we get, like, well, can I have baby food, or could I puree it? And I say, ew, no. And so my answer is yes, but we've never had a post-op patient come back who actually ate that. I mean, would you want to eat that now? No. And so you won't. You definitely can have a smoothie, but so any kind of smoothie is fine, but we have many people get in trouble with smoothies. What happens is not the smoothie, it's too much, too fast. So anything that's on the list that's okay is automatically not okay if you take too much, too fast. So people say, oh, I'm upset, I have what did you have? Well, I just had some Gatorade. Well, how much? Well, I had a whole bottle. No, you can't, not too fast. So post-op, if you have a craving for something, you're tired, let's say, of crackers and chicken noodle soup and crackers and chicken noodle soup and crackers and chicken noodle soup and yogurt and crackers and chicken noodle soup. Have anything you want, but have it in baby spoon size. Chew it very, very carefully and take it slowly. And we tell this to people all the time, and then we do the experiment of we let you out into the wild. And you call us back having not listened. So that this video will be a good thing for people to go over again and again. And here's what we're saying. Can you have regular soup? Sure. Does that mean that you can pour off all the liquid until you have a solid brick of leftover soup stuff? No. And that actually might be okay, but if you took one bite. But too much of that too fast will hurt your little stomach. Could you have a McDonald's hamburger? Yes, maybe a little. But how much? One little bite, very well chewed, very slowly. Now, if you don't do that correctly, then this is going to lead to a lot of punishment of me by Trish and Sandy and Jennifer, because you'll be calling, fussing. So please listen. Tiny bite of a hamburger is fine. So if you get a craving for something and you're tired of stage 1, almost anything is okay at almost any time. What we expect, and let me turn this around to a question, is that your tastes are different than they were before. You're less hungry. So we would expect that sometimes a small bite of something that you're craving is very satisfying. So you don't have to eat the whole hamburger to get a lot of satisfaction out of having a bite of hamburger. You don't have to eat the whole prime rib, the whole tuna fish sandwich to get all the enjoyment out of it. So you can start to eat early. One of the most important things is to eat frequently to keep up the salt that we talked about, and almost anything's okay. And I'll touch on one other kind of bit of kind of urban legend that's around my surgery, and that is people hear from the Roux-en-Y patients that you can never drink liquids and eat solids together. Have you heard that one? Okay. That may be true for Roux-en-Ys. It's not true for us because the underlying truth is what we already said, which is small amounts, very well chewed, very slowly. So if you have a small amount of liquid and a small amount of solid, very slowly and very well chewed, you're fine. But if you have a whole lot of liquid, even though it doesn't have any solid, it can cause trouble. If you have a whole lot of solid, even without any liquid, it can cause trouble. If you have a whole lot of solid and liquid together, it'll cause trouble. Not because they're solid and liquid together. It's a trouble because it's a whole lot. Many of our patients have said that they remember and feel cravings from beforehand, and they really want to have, I had a lady who really wanted a chicken salad sandwich, hamburger. Favorite food pre-op was?
Steak.
Steak. I want a steak. Favorite food pre-op?
Probably steak.
Steak. Favorite food pre-op? Chips and guacamole. So we would say to each of you, have one post-op. But what you're going to do is take that steak, and do you want the cheap Sizzler steak or do you want filet mignon for this? Filet mignon, you want the tender steak that's going to be easier to chew, as opposed to a piece of shoe leather for $4.99 at Sizzler. Nothing against Sizzler. I spent my whole college there. I got through college eating at Sizzler. So that little bite of steak, again, instead of eating the whole fillet, now, post-op, you probably only need 1 or 2 bites. And so again, if you can think of cutting it up to the size of a little cube of meat that's in a soup, and chewing that really well and going very slowly, you'll probably be fine. And same thing, chips and guacamole, have a bite. And take your time and relax. And you may find that you're not craving it after 1 or 2 bites because your hunger hormone and your satiety hormones have been changed. The ghrelin or ghrelin and peptide YY are different. So you may find that after 1 or 2 bites, you're done. You're very satisfied. And that's the real story behind the hamburger story. That is, he had 1 or 2 bites. He got rid of his craving. He got what he wanted, and he could relax.
Question?
Yeah. Well, does that answer that question before we go on? Okay, so I'm going to stop, and you'll find that